Hi, it's Dr. Jerome Fryer. How many of you therapists are evaluating posterior to anterior forces and also asking patients where it hurts? There's a lot of anatomical structures that are pain generators that you can assess when a patient is lying prone. With this dynamic model, you can see that if you push on specific locations, you can ask the patients where the sensitivity is to give you a better idea and where pain generators are. For example, if you push posterior to anterior on a spinous process, that approximates the facet joint. And you can walk up each segment, and it just takes gentle force. If you gently press with your hand, ask the patient specifically, ask them, does it hurt at this level? Is that achy? Is that achy? This will provide you with clinical information about the pain generator, and also it allows the patient to understand that you understand where it hurts. I think the differentials are the facet joints. I think that could be if it hurts to push posterior to anterior, you have to think at least a facetogenic pain generator. Secondarily, you have to think about it sort of a segment that's a little unstable, not clinical instability, but subtle instability causing the facets to approximate. You can even create forces on the SI joints. And I would suggest using gentle force, all the while asking the patient whether that recreates or creates some discomfort in their back. Too many times we're more interested in what we feel. And I think the reliability studies aren't very good on detecting these subtle, the resistance between the vertebrae or what have you. It's time to start asking the patient specifically where it hurts. And this is going to link up with the great work that Greg Kawchuk and groups are doing with straight posterior to anterior evaluation of stiffness. And we just saw that stiffness, the language stiffness, is often incorrect. So what else are we finding? What else are we seeing? We're likely seeing joints that are moving too much. So, anyways, that's my little rant this morning, and I want to make sure that everybody is evaluating the patient from a patient's perspective, not so much from a doctor's perspective. Patient-centered care is going to lead the way.